Hello, hello. I know it's early in the morning. This is the only time I had available today because today we're going to be doing a few surgeries and some clinic. But one of the surgeries I'm doing is on fibroids. So I wanted to talk about fibroids and what they are and what you can do to treat them on the spectrum of intervention, not so much on the aspect of alternative therapies, although there certainly are some of those as well. But what I wanted to talk to y'all about today is more the aspects of what a fibroid is. And basically, if you think about like the knots in a tree, that's kind of what fibroids look like. They're whorled, kind of hard knots, and they can be anywhere from the size of a pea to, gosh, the size of a soccer ball or bigger. And you can have multiple fibroids. And the two things that fibroids cause the most issues symptom-wise are pain and bleeding. And when they get to be to the point where they're big enough to start causing symptoms, that would be when you might want to seek the help of a provider. And basically, fibroids have treatment plans that go all the way from doing absolutely nothing, because usually you don't ever have to do anything. There's a chance of having leiomyosarcoma, which is a cancerous formation inside that fibroid of about 1 in 100. So it's 1 in 500. Sorry, it's rare, but it can happen. So you can do nothing. We keep an eye on them, watch to make sure they don't grow rapidly. You could do birth control pills, and while birth control pills are an option, they're not going to fix anything. They're not going to make them go away. They're not going to make them get better. They could help stabilize bleeding if you're having a significant amount of bleeding. This could definitely stave it off, but it's not going to actually fix the fibroid. It's not going to make it go away. So if somebody gives you birth control pills, just understand that it's not fixing the actual problem. It just make it stay where it is. A step above a birth control pill would be an injection called Depo-Lupron, which basically puts you into menopause a month at a time. And the point of Lupron would not be to fix the problem. It would be to stabilize you until we could get you into the operating room. And that would be in cases where the bleeding is so severe that you're anemic. A case that I'm doing today, the lady is very anemic from her fibroids. And so you could try to use the Lupron to build up her blood count while you're waiting. The fibroid also may shrink a little bit from the estrogen, because fibroids love estrogen. So if you can bring the estrogen levels down a bit, you could actually shrink them a tiny bit. A step above Lupron would be to start moving into the surgical arena, and the most minimally invasive surgery to do is Acessa. Acessa is a procedure that's been out for a couple of years, but it's really just kind of rolling out right now. It's a radio frequency heat ablation where we put a camera in the belly and we put a needle inside the fibroid that then has a little array that comes out that heats up the inside of that fibroid and eventually kind of denatures the proteins, breaks it down, and then the lymphatic tissue eventually clears that out. Now, again, not necessarily 100% reduction in the size of that fibroid, but probably around 50 to 70% of that fibroid over a 3 to 12 month period will go away. And for many women, that's enough. That debulks it, that makes the bleeding better, that can make the pain better. And especially for a woman that wants to keep her uterus or wants to keep her fertility, and she doesn't have other means, or she doesn't want a hysterectomy, obviously. The other thing is that women that have this procedure don't necessarily need a cesarean section when they have a baby. A step above Acessa is called a myomectomy, and that's where we go in and make an incision on the uterus and kind of shell out those fibroids, remove them, physically remove them, put stitches in the uterus, and put everything back together. Now, many physicians nowadays are doing myomectomies open still, where they're making a cesarean incision cut. There are many physicians out there that will do these laparoscopically, including myself, where we make a smaller incision, about an inch possibly, in the belly button area, and remove a big fibroid. Like last week I had one that was about 3 pounds, or 1,200 kilograms that we removed through the belly button instead of making a big incision. And it was about the size of a small soccer ball. But that's a possibility as well. And then in between there, you can do a myomectomy where you remove any big fibroids and you do the Acessa on smaller ones. So we can do a combination therapy. And then a step above myomectomy is obviously a hysterectomy, which would obviously eliminate the issues that you're having with the fibroids altogether, because you wouldn't have a uterus anymore. But it's obviously the most invasive on that spectrum. Are they genetic? Yeah, we think that there's a genetic component to fibroids. We don't know exactly what causes them, but they obviously run in families, and we know that there tends to be also a distribution amongst races that's a little bit different, where Caucasian women, about 1/3 of Caucasian women will have fibroids in their lifetime, and they could be really small, but that's the percentage, compared to about 50% of African American or Mexican American women tend to have more fibroids. It's about 50%. So definitely something to look at if you're having pelvic pain or bleeding that's heavier or irregular. Go to your physician. They can do an ultrasound, pelvic exam, find out what's going on. But fibroids have a whole range of options. It doesn't ever have to be one way, all the way from doing absolutely nothing to birth control pills to Lupron to the Acessa procedure, myomectomy, hysterectomy. Combinations of those are also totally acceptable. So it doesn't have to be one way. You should never feel like you don't have any options. If you have fibroids and you would like a consult, you can always call the office, 512-956-0296. Will they show on ultrasound? Most likely, if it's a good technician and you have a fibroid that's probably bigger than a centimeter or 2 centimeters, definitely. The big ones will definitely show. It's just that if you have a lot of fibroids, they can cause shadowing on the ultrasound. So if you had a big, like 6 centimeter fibroid, it could shadow some smaller ones behind it. So, but they should show. You may not actually see all of them, but the bigger ones, 2 centimeters and up, should definitely do it for you. And Maddie just posted the office phone number. If you have a question about fibroids, give me a call.